Contact lenses themselves do not damage your eyesight. What may harm your eyes is the way you use them. The most common mistake is not always dirty hands or forgetting to remove the lenses at night. It is usually a habit that seems insignificant and is found in almost everyone who has worn lenses for more than a year. To understand the rules of contact lens use, you need to know one important fact about the eye. The cornea, the clear front part of the eye where the lens rests, has no blood vessels. It receives oxygen directly from the air. A contact lens sits between the cornea and the air. Modern lenses allow oxygen to pass through, but not without limits. That is why there are two main rules: allow the eyes to breathe and keep the lenses clean. The first mistake is sleeping in contact lenses. People usually say, "It was only once, I was very tired." Most of the time, nothing happens after one night, which is why it can easily become a habit. However, when the eye is closed at night, the cornea already receives less oxygen. A contact lens reduces the oxygen supply even further. Some lenses are approved for overnight wear, but they should be recommended by a doctor for a particular patient and lens material. It does not mean that sleeping in any contact lens is safe. The second mistake is wearing lenses longer than recommended. The lens still feels fine, so I will wear it for another week. May sound reasonable, but replacement schedules are not simply marketing. Proteins and oils from the tear film gradually build up on the lens surface. The lens slowly begins to allow less oxygen through, becomes more difficult to keep moist, and causes more irritation. You may not feel these changes immediately. Discomfort usually appears much later. Monthly lenses should be replaced 1 month after opening the package, even if you did not wear them every day. The third mistake is allowing lenses to come into contact with water. Showering or swimming while wearing lenses, rinsing a dropped lens under tap water, or moistening it with saliva may seem harmless. However, the lens acts like a sponge and traps substances from the water directly against the eye. Tap water and swimming pool water are not sterile. Contact lens solution is not simply a liquid that prevents the lens from drying out. It is a specially formulated sterile solution. The rule is simple: water and contact lenses do not belong together. The fourth mistake is improper care of the lens case. Some people replace their lenses on schedule, but use the same case for years. Others do not empty the old solution completely and simply add fresh solution on top. The case is where the lens lives. A dirty case means a dirty lens, even when the lens itself is new. The solution must be fully replaced every time. The case should be cleaned, left open to dry, and regularly replaced. The fifth mistake is continuing to wear lenses when the eye is red or uncomfortable. When an eye becomes red or begins to sting, people often use redness relief drops and continue wearing their lenses. Once the redness disappears, they assume the problem is gone. In reality, the drops may only have hidden the warning signal. A red, painful, or uncomfortable eye and a contact lens are not compatible. The lens should be removed and should not be worn again until the eye returns to normal or is examined by a doctor. The sixth mistake is buying lenses based only on prescription numbers. If your friend also has a prescription of -3, it does not mean the same lens will fit you. Contact lenses also have a base curve and diameter, and every person's eye surface is different. A poorly fitted lens may sit too tightly or move too freely. People often conclude that contact lenses are not suitable for them, when in fact they may simply need a different lens. There are also several common misconceptions. The first is, contact lenses make my prescription worse. A lens does not change the optics of the eye. Myopia progresses for other reasons. Incorrect lens use can damage the surface of the eye, but that is different from lenses directly worsening eyesight. The second is, expensive lenses can be worn for longer. The replacement period depends on the material and the manufacturer's instructions, not on the price. The third is, if lenses are uncomfortable, contact lenses are not for me. Discomfort may be caused by an unsuitable material, poor fit, or dry eye. In many cases, the problem can be solved after a proper examination and lens fitting. The main paradox is that the eye is very patient. It may tolerate sleeping in lenses, wearing them for an extra week, or showering in them many times. This makes the rules seem unnecessary. However, the effects can accumulate, and the problem may appear much later rather than after the first mistake. When should you see a doctor? If your eyes become red every time you put in your lenses, if you develop pain, a gritty sensation, tearing, or sensitivity to light, if your vision becomes blurry or foggy in lenses when it was previously clear. In these situations, remove the lens. Do not put it back in and have your eye examined. Do not simply wait or choose eye drops by yourself. If you have worn contact lenses for years but have never had the surface of your eyes examined, it is worth doing even if you have no symptoms. Checking your vision and examining the condition of the eye beneath the lens are two different assessments. If you wear contact lenses, come for an examination at Ko'z Nuri Clinic. The doctor will examine the eye surface, evaluate how your lenses fit, and explain whether they are suitable for you and which habits should be changed. If you are tired of wearing lenses and would prefer to live without them, that is also a good reason for a consultation. The doctor will determine whether other correction options may be suitable for you and will explain the possibilities honestly. This is safer than wearing contact lenses for years based only on how they feel.